Hi, everybody, and thank you so much for joining this call. This is our 7th time coming together to discuss how our community can confront this crisis, take care of one another, and emerge strong. A lot has happened since that first meeting on March 18th. In that time, beloved stores and restaurants have closed their doors, children have returned home from school, and we've all adapted to a new way of life. In that time, also, there have been nearly 100 cases of COVID-19 confirmed in McLean County. And unfortunately, 3 members of our community have died. We now know that existing inequalities are being exposed in new ways. To date, Black residents have comprised 37% of confirmed COVID-19 cases, despite representing less than 10% of our county's population. And we've heard many stories from people who are facing severe personal and economic hardship because of the rippling effects of this crisis. But along with those hardships have also been some shining examples of community, solidarity, and love. Hundreds of people have volunteered to help distribute and deliver food through countless community and religious organizations. Individuals have stepped up to support their neighbors, their friends, their family, and even strangers with small acts of kindness and intentional actions of mutual aid. If you haven't been a part of it, you've seen it. I've seen so many friends who apparently have sewing skills that were previously undiscovered. My favorite is a friend who has been sending me pictures. She's got 2 sewing machines, one adult-sized and one kid-sized, so that her and her daughter can both work at the same time to sew masks that they donate to local medical facilities. You know, and I've seen friends contributing to charities, putting their own safety on the line to ensure that people at high risk can get the food and the medicine that they need. And this isn't even to mention the countless people who we need to recognize because they're either willingly or unwillingly risking their own well-being and the well-being of their family on a daily basis to provide us essential services. So we should take a moment to acknowledge how much worse things could have been for us. If individuals had behaved differently, if support systems had not emerged, we could be looking at far more confirmed cases than we are. But while we should acknowledge the work being done by local organizations, the effort being put in by individuals, so many people doing the best in the worst of circumstances, we also know that individual responses are not sufficient. There are gaps. There will continue to be gaps, and there are people who are falling through them and more who will. Our intent in meeting each week is to ensure that the people who are hit first and worst by this crisis are not an afterthought, but rather at the center of our response. That's why we're here today. And so I want to get started, move on, and cover some ground rules. So first of all, if you're new with us, only assigned speakers are going to be allowed to speak, but we will open up the floor later on for questions and answers, at which point you'll be able to speak and we'll unmute you if you have a question. Second, if the moderator selects you, you'll temporarily unmute it, and then we're going to meet you again. We won't be kind of back and forth. If we don't get to your question or comment, you can use a sign-up form. We'll share a link, or you can just drop your questions in the chat box, at which point we'll make sure that somebody is going to reach out to you if we don't have time to get to it. And finally, we're going to be sharing various links through the chat. You may at some point see Lewis pop up, dropping links in that you can click on to get out to the various things that we discussed. And we'll be discussing those tonight through 4 main sections. First, we're going to hear about a community mutual aid update from Robert Garcia. Then we'll discuss how we can prevent crisis through decarceration and some of the other ongoing issues in the McLean County Jail. Third, we'll go and hear from our housing team about how we can secure housing for all and hear updates about what's happened over the 7 weeks that we've been working on this. Finally, we'll discuss protecting our neighbors with direct aid. There have been a lot of updates in the past week, and we're excited to come back, debrief, and talk about where we go moving forward. With all of that said, I'm excited to pass things on to Robert Garcia from McLean County Cares to discuss how our community has come together and provided aid to those who need it.
Thank you, Joel. Can you guys hear me okay?
We can. Thank you, Robert.
Perfect. Thanks, Joel. As everyone knows, there has been a sharp increase in community need due to the historic recession caused by the COVID-19 pandemic. what has been most inspiring to witness is the wonderful response by our local community. The pre-existing resources without augmentation of new services simply would not have been able to meet this sharp increase in community need and demand. But thankfully, we have seen both individual and small group services pop up all around the county. So today I'll be highlighting 3 of those community responses. I know there's a lot more, so at the end I'll share a couple of resources where folks can connect with the help that they need. But first I want to highlight this group's mutual aid response, the McLean County COVID-19 mutual aid team. The work that the mutual aid team does is so important because it focuses on our community's elderly population, those who are most at risk and who really need to stay sheltered in place for safety. So we're really very grateful to the folks that are leading that because they're focusing on our population's most vulnerable, the elderly. So thank you to the mutual aid team. The second is McLean County Cares. The McLean County Cares team is kind of an escalation service, if you will, from the mutual aid team. The first program I highlighted is a free errand service, but those folks are still paying for their goods and services. And with McLean County Cares, we're trying to identify those who are not able to afford groceries, who perhaps have fallen through the cracks with other programs that they may not qualify for, or don't have transportation and don't have the financial means. And so McLean County Cares delivers weekly basic food and basic supplies to those in need. And I think, Joel, you've got 2 testimonials that we wanted to play just to help folks understand the need and the gaps that we're trying to fill. I'm not able to hear. Is anyone else able to hear it?
Sorry, please excuse the technical difficulties. Just one moment.
Okay. I can play it on my side. I don't know if it'll work, but I can try if you need me to.
Hello, my name is Janice, and I have received so much help from Mutual Aid and McLean County Cares. I am almost 60 years old. In June I'll be 60. I have immune problems. I have asthma and all kinds of things, and I have mental illness as well, and I don't have much family around, and they have helped me so much that it was beyond belief. It's beyond belief to me because I don't have a car. I live on Social Security, and I am so grateful to Robert and some other people that I can't remember their names. People have been beyond helpful. I cannot express that enough. Be out and about. I could be in a hospital. Who knows? Anyway, I so much appreciate what they do. Thank you.
Hi, my name is Yasmin, and I came across Barbaric Services at a time that I really needed, being that I was 8 months pregnant at the time and out of a job. I really did not have the resources, and I really needed help. And I appreciate the fact that he is doing something for the community and everyone can get help from him. Like, he don't make you feel bad, he don't judge you. Like, if you need help, he will offer help to you and anyone else that needs it.
So again, as you can see, there's plenty of folks with lots of different situations. We have a young mother who called us the day she was literally from the car. She was leaving the hospital with her newborn baby, and was, nervous, looking for help, in dire need. And so we've gotten calls that come from OSF. We've gotten calls that come from professors who have reached out to students and that are still here and said, hey, if you're in need. So we appreciate folks that are spreading the word and helping us identify those that are most in need that really have not been able to meet those needs through other programs. So thank you very much, Louis, for posting those links. The third program I want to highlight is the Immigration Project. They started a new program. What they identified, obviously, unfortunately, in situations like this, the immigrant community is often left behind or left out, unfortunately. The administration sometimes targets them on purpose to leave them out, and that's unfortunate. And other times it's just either through perception and fear. These folks live in a constant state of fear, and they're afraid to go to the food banks that require ID because they don't have it, and they may be concerned about somebody calling ICE and whatnot. So understandably, there was a tremendous need there, and we're really appreciative of the work that the Immigration Project has done to close that gap. So they've partnered with the United Way Immigrant Relief Fund. And what we've done is we've reached out to local restaurant owners and asked them to partner with us, and they get a small stipend per meal. So they're taking a loss on these meals. We're paying them through the United Way's Immigrant Relief Fund, and then the Immigration Project in partnership will, we have 2 sites that we meet at, Tuesdays and Thursdays. I'll post this here at the end for folks to want to follow that along. It's also on the McLean County Cares page that Louis just posted, so it's there as well. But this is obviously open to anyone. It targets the immigrant community, and there's no ID required. So we appreciate that work. I want to give a quick shout out to Siva Busa, the owner of the Aroma Indian Restaurant, who has been a very strong advocate in responding to the community in need. He's been partnering with both McLean County Cares to help us deliver hot meals to those in need. And tomorrow he's doing 150 meals through the United Way and Immigration Project partnership as well. So he's doing a lot. And we have a call tonight with the owner of Signature Indian Restaurant, who's going to also be joining us. So really, really appreciative of the Indian community's response and just reaching out and aggressively saying, we want to help. What can we do? What can we do? So I want to give them a quick shout out. Lastly, I'm just going to post 2 quick links here. There's a lot of other resources that you can reach out to. There's an entire directory. The first link I'm going to post is bmprepared.org. Please go online if you or someone you know is in need for a directory. And the last one is 211 or Path Crisis Response. You can dial 211 on your phone, or you can go to that link that I just posted in the chat, pathcrisis.org. They have a very robust directory to meet practically any need. So if you or someone you know is in need, please do reach out via those resources. At this time, I'm going to turn it over to Reverend Black, who's going to lead us through our faith grounding.
In the book of Zechariah, chapter 7, verse 9, this is what the Lord Almighty said: administer true justice, showed mercy and compassion to one another. We are challenged by God to administer true justice, show mercy and compassion to one another. This public health crisis has created crisis, chaos, and confusion, and has discombobulated our lives. Food and housing insecurities have been magnified and personified. Shelter in place is something that was not in our vocabulary before March 2020. The vulnerable groups of people do not have jobs that permit them to work from home. Some of their jobs no longer exist and may not be resurrected when this storm passes. Our life as we once knew it will be changed forever. When we get to the other side, we will have a new normal. At this point, we do not know what the new normal will look like. But what we do know is we all need each other to defeat this pandemic. We need to work together to protect our most vulnerable people groups. This disease wreaks havoc on all individuals, young, old, rich, and poor. To recover from this havoc, it is more difficult for the most vulnerable. Therefore, God has called us to work together to administer justice, show mercy, and compassion. Protect Our People has focused on decarceration, housing, and direct aid. Those housed in jails and prisons are not able to social distance. Thus, we are asking those in power to release people who are incarcerated because they do not have cash bail, and nonviolent offenders. We're asking those in power to reduce and or eliminate the cost of video conferencing and telephone calls during COVID-19. We're asking for a plan for housing and testing those who are homeless. People have been out of work for 6 weeks and without a paycheck for about 4 weeks. We are listening to our most vulnerable population to understand the need for direct aid. Many of the nonprofits in our community have come together and are addressing the food needs. The McLean County Cares and the Mutual Aid team are providing resources and help to those in our community. Yet there are needs for funds to cover bills beyond utilities. In sum, administering justice, showing mercy and compassion during COVID-19 in Bloomington, Illinois is what you, the people protecting our community, protect our people are doing. Justice is about making things right and equitable. Compassion means to have concern for the suffering of others and doing something about it. It's not enough to have pity and sympathy, but to do something to alleviate the situation. Do not get weary in well-doing, for at the proper time we will reap a harvest. Working together, speaking truth to power, will bring about the necessary relief needed. We will win against this virus and help our people to survive and thrive during this pandemic. Together, we can administer justice, show mercy and compassion in our community. We are all in this together to protect our people. Next, we will have Olivia Butts from Black Lives Matter to discuss decarceration.
Hi, good evening. So I wanted to just give everyone a quick update about our most recent push, which has been a fundraiser towards our call fund. So we've been raising money to support folks who want to call their loved ones who are currently incarcerated in the McLean County Jail. We've already received over $2,100 and we've spent just under $1,900. So we've been able to put money on 43 different people's accounts so that they're able to call and video chat with their loved ones while in-person visits are shut down here in McLean County. So we're also hoping that we'll be able to put a little bit more money on people's accounts as we're getting to May, and there's some maximum limit accounts that will be reset next month. The other thing I wanted to give an update on is we still haven't heard anything from the county board. So they had a meeting last week, and we kind of asked a little for some more information from them about a contract that they have. We know that they have a contract with IC Solutions, which is a telecommunications company, and that is actually how they run their video and phone calls. And we know that those contracts come with a commission based on video visits and phone calls from incarcerated folks and their loved ones, which means that yes, the county does make money off of phone calls and video calls between inmates in the McLean County Jail and calling their loved ones outside of the jail. And obviously because of the coronavirus, we know that in-person visits have been shut down for over a month, and that phone calls and video calls are the only way that people are able to contact their loved ones in the jail right now. So this week, we're really asking for you to get involved, and we're asking that you reach out to your representative on the McLean County Board and ask them two things, okay? So the first is, what is the commission that the McLean County Board is receiving from IC Solutions? From inmate video and phone calls, okay? And the second one is, can the McLean County Board use that money that they're making in commission to subsidize costs or waive costs for phone and video calls during the coronavirus? I just don't think that McLean County Board should be making money off of inmate phone calls and video calls when that's the only option for people to stay in contact with their loved ones, especially during a time when you want to be in contact with people you love, and because, as we know, there is no social distancing in jail. So if you're able to reach out to your McLean County Board representative, we'll drop the link so that you can figure out who your representative is if you don't already know. But if you're willing to do that sometime this week, can you go ahead and just in the chat box drop a yes So go ahead and type yes in the chat box if you're willing to reach out to your McLean County Board representative and ask them those two questions. So how much money are they making off these phone calls and video calls? And can we use that money to subsidize these costs for people in the McLean County Jail? So now I'm going to pass it over to Dawn and Radiance, who are going to update us on housing.
Hi, everybody. Hold on a second. I have lost my page. I'm sure you're all aware we're still in a shelter-at-home order from our governor. And adhering to that means we're supposed to limit our face-to-face contacts to the people we live with. So what does that mean if you're sharing a single shelter room with 58 other people whose bunk beds you can reach out and touch from your own? For weeks, we have been asking our elected officials if there's a county plan for dealing with the possibility or the probability of an outbreak of the COVID virus in our shelters. We've heard yes, and we've heard no, but we have yet to see an actual plan. We don't know why it would be secret if there is a plan. What we do know is that transparency is important in a pandemic, and we're going to spend just a few minutes talking about why. The initial community outbreaks of the coronavirus happened in Seattle and New York City at almost the same time, but the city's experiences with the disease have been very different. By the second week of April, Washington State had roughly 1 recorded fatality for every 14,000 residents, while New York's rate of death was nearly 6 times higher. Now, obviously, the population is more dense in New York City and more people rely on public transportation, so more people are coming into contact with each other. But these variables, while they might explain some of the difference between the two cities, there were also some extreme differences in communication and practice in the way that they handled the virus that also leads to different outcomes. Experts at the Epidemic Intelligence Service, also known as EIS, believe that communication and practice are the key to having successful outcomes during an epidemic. They are part of the Center for Disease Control, or the CDC, and they are central in combating outbreaks. They believe that a pandemic is a communication emergency as much as it is a medical crisis, and that scientists and medical professionals must play a front and center role. So in Seattle, the leaders moved really fast to persuade people to stay at home and to follow scientists' advice, while in New York, leaders moved more slowly and let politicians' voices dominate. So today, Washington State has less than 2% of the coronavirus cases in the entire United States, with 13,000 confirmed cases and 700 deaths. Compare that to New York City with 282,000 confirmed cases and nearly 17,000 deaths. So even accounting for the differences in population and focusing solely on ratios, Washington, Seattle in particular, has had a fraction of the deaths of New York City. In a New Yorker article on the Epidemic Intelligence Service on Sunday, and let me disclose that much of the information that I'm sharing with you tonight was taken directly from that article, the CDC says that in combating outbreaks, transparency is essential. That is a direct quote from their handbook. And this is an area we feel needs attention locally. If you were to go back and to play a recording of the previous 6 weekly calls that we've had, one of the themes you would hear over and over and over again is the lack of transparency by our local governments. For 6 weeks, we've been asking for a housing plan. Initially, there was radio silence on the issue, and then during a McLean County board meeting a couple of weeks ago, we learned that there was a group that had been working on a housing plan. But as I mentioned at the beginning of this section, we still haven't seen a copy of that plan. How can we evaluate if a plan is adequate if we can't see the plan? how can we trust that there really is a plan if we can't see a plan? Reverend Black just told us not to grow weary, but it's hard not to grow weary when we are repeatedly ignored by the elected officials who are there to represent the people. We monitor the McLean County Health Department website daily. We're glad to see that the curve is taking a downward trajectory right now. And maybe we've dodged a bullet. We hope that's the case. But we've also heard from medical experts across the country that things will likely be worse in the fall. And we know that many people with the virus are asymptomatic and they can spread the disease without even knowing that they have it. So relying on an outbreak of symptoms before taking action is just too late. We need a plan, and we need it now. Earlier today, we used the Freedom of Information Act to request any information from the county board pertaining to a plan during the COVID outbreak on housing. For our elected county officials on this call, we are asking you to please develop and disclose a COVID-19 housing plan before our next community meeting, which will be 2 weeks from tonight. I'll talk about that further. We're asking you, please, no more secrets. And now I'd like to turn this over to Radiance, who is going to talk about how we can try to fill some of the safety gaps for those people who are living in shelters right now. Radiance?
Hey y'all, so we are having a little mask drive and a mask making Zoom party for the Salvation Army this Saturday, May 2nd at 7 p.m. Despite the risks to personal and public health, many homeless and housing insecure individuals are forced to be in congregate living environments where social distancing is not possible. Additionally, with the extended stay-at-home order, individuals will be required to wear a face covering or a mask when in public places. Individuals without a face covering could face a fine, but we know that not everyone has equal access to protective masks. So while we call on our elected officials to provide safer alternative housing to these vulnerable members of our community, help us do what we can to make sure that they are able to protect themselves with masks. Your mask donation will help our community members at the Salvation Army follow the new requirements and keep themselves and our community safe. We'll be dropping a link to the Facebook event in the chat box soon, so check that out and get involved. You can pledge to make 2, 5, or 10 masks using the Sign Up Genius link in the Facebook event description. You can join us for our Zoom mask making party this Saturday or make the masks on your own time. And then use the info in the Facebook event description to drop off your donations at the Salvation Army. And please let me know, or any one of us on this call, if you are self-isolating and need someone to come pick up the masks from your doorstep to drop them off for you. The Salvation Army has identified a need of about 80 masks, and right now we are sitting at about 40 pledges, so we're halfway there. Please consider pledging, and please share the event with your mask-making friends. So I'm going to toss it on over to Jeff now to talk about direct aid.
Thanks, Radiance. We wanted to start the talk about direct aid with giving a brief summary of the recent Bloomington City Council meeting this past Monday. First, we had tons of public comment, and a number of you on this call participated in that. I found all the stories to be very compelling, and it makes me think that as a public policymaker, you can't just look at facts. You have to put yourself in other people's shoes, and that gets you to what Reverend Black talks about with regard to compassion and taking action. We had a number of speakers Monday night to talk about what they are doing in their respective groups. The first one was the township supervisor, Deb Skilred, and she talked about how the township is budgeted to handle mostly those that are indigent, people that aren't otherwise working. And she is not equipped in her budget to handle the expected increase in need that we're going to see. And then we had Patrick Hoban from our Economic Development Council speak on how the county is helping our small business community. We then had Karen Zangerly from PATH, and really what she said is, in essence, this is an unprecedented crisis. Her PATH is the 211 service, and they receive calls for all kinds of needs, and they are seeing a jump in requests for food, and they're seeing a jump with issues, and they expect to start receiving, or they are starting to receive, more calls with regard to housing. And Karen does not believe that what PATH has is sufficient to meet the needs of people when we talk about housing. And then the last presentation was by the United Way, and they talked about what they're doing in the food area, serving over 1,600 meals a day. But again, they've already spent $130,000 just on food, and they know, United Way says, they can't do it all, and so it has to be a collaborative effort, a public-private partnership, and so I think it was a powerful meeting to match the needs of the public comment and the resources available and the gaps that exist. At this point, I will then turn it over to Joel. Are you there, Joel?
Now I am. Thank you, Jeff.
All right.
Thanks for that debrief of Monday night's meeting, and I really do hope that people who are on this call were able to hear that meeting. It really was a great opportunity to hear from people who are working right now, trying to respond to this, and to hear from people who shared their personal story of how this crisis has impacted them. And it was very clear by the end of that a lot of good work is being done and that the resources available today are insufficient. And so what I'd like to do is walk through kind of what is the big picture when we talk about direct aid. We've been talking about this for a few weeks, and we've covered the principles of what we're looking for, and we've talked about what we want our local government to do, which is to allocate money to support people's needs. But what are those needs? And first and foremost, it breaks down into 4 basic categories, and there are others for sure, but that's food for your family to eat, to survive, housing, shelter, where you can live and be protected, utilities for your electric, your water, your gas, and today, particularly today, phone and internet as well, and healthcare, the ability to see a doctor, or get your prescription medicine, whatever you need to stay healthy. All of these things are important, but to be able to have any of these things, you need money. And what we know is that the best way we can support people is through making sure they have the resources available to get the things that they need. And why is that a problem right now? Well, we know it's because of unemployment. And I'm sure that many of you have seen these pictures, this graph, heard this many times. But right now, unemployment is higher than it was at any point, or sorry, initial claims for unemployment are higher than it was at any point during the Great Recession. You can see on this graph where that high mark was for the Great Recession back in 2008. And then about triple the size of that is where we were in March last month. It's about 5,000 people in McLean County, and we should be very clear that when we look at those people, those 5,000 people, that's only accounting for March. And since many of the layoffs and closures that we saw happened in the final 2 weeks of March, that means we're accounting for a very small portion of what's happened to date. And it's only accounting for people who actually got through on the unemployment line. And we know that the state has had to increase their web server capacity. They've contracted with additional third parties so that they can increase their call capacity because people weren't getting through, which means that this is already a dramatic number. 5,000 people in our community who we know for the past month have been filing for unemployment. And there are more, there are going to be more. And so what does that initial claim actually look like? I just want to jump into this really quick. Well, it's a request for determination of insured status or a notice filed when a break-in job attachment has occurred. In other words, this is an ask. It's filing a claim for your unemployment insurance, and in no way does it guarantee that you're going to ever see anything. Not every claimant will receive a benefit. So when we talk about these 5,000 people who in about a week, I'm sure we'll find out, is far many more people. We're not talking about people who are getting unemployment benefits or waiting on unemployment benefits. In some cases, we're talking about people who are never going to see a benefit, but yet they are unemployed, they're out of paycheck, and they do not have a source of income to cover their bills and to cover the essentials. We also know that for all of those people who lost their job, it's not just a paycheck that they lost. In many cases, they may have also lost their health insurance, which means that if they have any kind of health crisis, whether it's COVID related or not, they may not be in a position to cover that cost. And in fact, a recent survey was done, which found that 55% of people who have lost their health insurance as part of this crisis because they lost a job, 55% have no ability or plan to cover health insurance. And 45% of people said if something happened today, they would avoid medical attention because they do not know how they would pay for it. We know that some people will qualify for Medicaid, but that can take months and months, even under normal circumstances, when there aren't so many people searching. And there are very few options available to people otherwise. And this is from United Way. I want to give them credit for these figures and these graphics. We know that this is in addition to what's already a problem in our community. Nearly 12,000 households in McLean County lived in poverty before this started. That's a 73% increase since 2010, which is, since we saw those high numbers during the 2008 recession. And many of those people, they're not going to be able to count on a second income from their home. They are likely to be single mothers. They might be single fathers. They might not have anything else to fall back on. And this creates a problem because functionally our community is only as strong as the most vulnerable people. And when people start to fall through the cracks, not only does that impact them, but it impacts everybody around them, and particularly in communities which are already held together by bare threads and supporting each other. When you remove that income from one person, that can have a ripple effect through an entire household, through entire family structures, through entire neighborhoods and communities. And we are playing with fire if we don't make sure that we address things. And so I want to pass things back over to Jeff. We want to kind of walk through these 4 categories: food, housing, utilities, and healthcare. Where are we at? Where do we need to go? And what's our status? So Jeff, I'll toss things over to you.
Hey, thanks, Joel. So you'll see in the colored boxes, right? So the green boxes is kind of like, hey, we're going pretty good. Yellow's cautious. Red, there's still a lot of work that needs to be done. So there has been an emphasis made in this community on providing food assistance to people. And you have churches, a number of churches having food pantries and providing meals. You have the United Way, who has been able to work with restaurants in the community to provide, like I said before, 1,600 meals a day. But they know that's just a drop in the bucket with regard to the need. Also, typically these meal services are not done on the weekend. Restaurants just don't have the staff to do it 7 days a week. Communicating with the people that need it is also an issue. United Way has worked with the schools to try to reach those students and their families. And we know that food pantries have had issues with regard to distribution. Midwest Food Bank is trying to not only provide food for this community, but they have offices, distribution centers across the country that they also have to meet, and so they're having trouble getting supplies and getting them to the food pantries. So green light mostly on food, but there's still gaps.
And Jeff, I know we just talked about there being 5,000 people in March who filed for unemployment. And
right.
I know United Way spoke to the council on Monday. How many meals did they say they're currently providing?
It's going up. So I think that they anticipated for this week providing 8,000 meals for the entire week.
8,000 meals, but we know that there are thousands of people who are unemployed, which ripples through households of individuals, which means that the need could be far greater.
Exactly.
Yeah.
And then on housing, so I would say the big issue, with housing is that, yes, right now there's a moratorium on evictions, meaning that a landlord cannot seek eviction during the moratorium, and the courts are closed to even try to get an eviction. But what we know is that the rent is still due, right? If you had a rent payment due April 1st, it's still due, but you don't have to pay it right now. So there will come a time when that moratorium will end and people will have to pay that back rent. So you're talking about 2, 3, 4 months worth of rent, having to pay that all at once, and potentially without any source of income, because the jobs aren't going to come back as quickly as when your rent's going to be due. Also, the homeless shelters, they have restrictions, and they are close to being at capacity. We really don't have shelters, for instance, for people that, say, a parent with a child of a different gender. A lot of times shelters won't be able to handle that, because the parent has to stay on one side of the shelter, and then the child may not be old enough to care for him or herself. So there's gaps there. Also, domestic abuse shelters, and there's no contingency plan if that capacity is exhausted. Going back to the housing piece, is there a plan? They say there is, but we don't know what it is. Also, what about people in high density situations? What are their housing options if there is a COVID-19 outbreak in one of those situations? So there are significant gaps in housing. We actually haven't really seen the full need of housing. That is, as the United Way said on Monday night, we're expecting for that to really ramp up, the need to really ramp up in the next 30 to 45 days. Joel, anything I missed?
Well, I just want to point out, Jeff, I think you and Council Member Emig had a great question for Karen Zingerle on Monday, which was about this issue that by the time the eviction moratorium ends, people are going to have months and months of back rent. And is that something that PATH or any other community organization is prepared to tackle and to handle? And from what you heard, did it sound like that's something that there's any preparation for, that we have the resources to handle?
We have a coalition. Again, it's kind of secret. We don't know exactly, but we have United Way leading a coalition trying to figure out, the housing issue. You've got townships involved with that. You have PATH involved with that, but we don't have a plan yet, right? And so. Without that plan, then it's just more likely people are going to fall through the cracks.
Yeah, and then I think right there with that is utilities, and speaking of the township in particular, they tend to assist people who are in need of rent and people who are in need of mortgage assistance and people who are in need of utility assistance. And right now, thankfully, shutoffs are halted. Your water, electricity, gas, even telecom services are not going to be shut off in the state of Illinois. But the bills are still coming in. And by the time that this ends, it's possible that people who didn't have income during this time and did not receive unemployment benefits, who struggled to get any of the benefits that are currently out there, could have months and months of bills to pay. And then be facing a shutoff when this is all over and we start to go back to normal. And at the moment, we know that there are resources coming into the community through a variety of organizations, but right now it's not enough to go through the entirety of this crisis. And there's no additional resources right now for residents who exhaust the options that they do have, which would be LIHEAP assistance and township assistance. And so this is a serious problem, especially for people who already relied on those services, because in addition to the amounts that they would be asking for if this didn't happen and we didn't have COVID to worry about, they might have additional months and months of bills that they have to find assistance for and have no way to get it. Anything I'm missing on utilities, Jeff?
No, I was just going to say, I think the internet is a big thing. People rely on the internet to do pretty much everything. And, people have the option of going into the library, for instance, as a place to access the internet and that's no longer available. And you have parents that need internet to, with regard to their children to take their school lessons and things like that. So that's something that's people don't necessarily realize how important the internet is.
And it is worth noting that right now shutoffs have been halted by most companies, but some people might struggle getting internet access if they didn't have it before and they relied on a library or somewhere else. They might not have a means of getting that today. And then moving on from utilities, we have healthcare. And with healthcare, we know that this is oftentimes going to be canceled as soon as you lose your job. You lose your healthcare all in one go. And so we have Medicaid to look to, but that can take months to secure, even under normal circumstances. There's COBRA. If you're eligible for it, it's extremely costly and not affordable for many people, particularly if you only have a single income household. And even then, if you manage to get it, deductibles and copays may be unaffordable because of other economic factors related to the crisis, even for people who have their regular insurance, particularly if one member of the household provides insurance and they lose another income, suddenly that plan might become unaffordable for them to actually get the healthcare that they need. Additionally, we know that mental health, our system is already strained under normal circumstances. And we don't currently have active plans to make sure that people are able to get the services they need, particularly in an environment where face-to-face conversations are not feasible. With prescriptions, there are really not known targeted assistance available for people. It's a very patchwork system, and that means that people might struggle to get the prescriptions that they need, even if they are able to get everything else. This is something that's crucial. And the downstream impacts of all of this can mean if we have an increase in people on Medicaid and a sudden influx of people who are uninsured, that our system can be overwhelmed. We have a system of community clinics and local doctors who take Medicaid, but with that increase, we can easily strain those providers and end up in a situation where people struggle to get what they need. And so all of this comes back to the question of what should our local government do? We've talked about some of the gaps that we face with food, with healthcare, with housing, and with utilities. And so what should the government do? What should our local government do to make sure that we remedy these? And the answer is direct aid. So what does that look like? Well, first, it means that our local government needs to be prepared to fill funding gaps. One, for programs with demonstrated success who have exhausted their available resources or are waiting on guaranteed funds to arrive. We know that there are programs in this community people are depending on, programs that today may be able to offer service and aid and assistance to people who need it, but might not be able to tomorrow when they run out of money, or who might be waiting on a check to come from a state program and have to turn people away until it comes. And our local government should be prepared to step in to make sure that doesn't happen. Second, we need to expand our existing assistance mechanisms to meet the needs of people in this moment. In particular, in Bloomington, we have a township assistance program to support people who need help with their rent and their mortgage payments that right now pays about $400 or less to support up to 1 month of assistance. And that's not sufficient. We need to make sure that those existing programs are covering what people actually need to get through this. And that's not enough either. And I'm going to pass it to Jeff to talk about the last and what I think is the most important point about direct aid and how our local government should respond.
Yeah, the local government, needs, Bloomington City Council needs to have accountability and responsibility for those that fall through the cracks, where they've exhausted available programs from nonprofits or other government resources that may not qualify for existing programs. And we need to meet the need when it exists versus forcing somebody to wait to get a stimulus check or wait 2 months to get unemployment. If people need assistance now, that's when local government should do what it can to step in and fill that gap.
I agree, Jeff, and I'm really thankful that you've been a champion for that on the Bloomington City Council. Thank you so much for doing that, along with Jim Carrillo and Julie Emig, and with support from Scott Black. And I hope that we get a fifth vote, and maybe even 6 or 7 or 10 people who agree with us and decide that responsibility and accountability is really where this city of Bloomington should be. And hopefully we get that also from the town of Normal and the county board. With that, I'm going to pass it to Cecilia to talk to how you can take action on this and the other things that we've talked about tonight.
Hi everyone, it's been 6 weeks and we've seen everyday people jump into action to form groups to provide mutual aid. We've seen our nonprofit organizations pull together what resources they have to meet needs they can address, and we've had individuals speak out and share their stories of how the COVID-19 crisis has been impacting their lives. But still, so many of our local government officials are continuing to shift responsibility onto nonprofits and ignore the people's call for help and action. That's not right. So we're calling on you. Help us protect all our vulnerable neighbors. Here's what you can do this week. To support those who are incarcerated, we're asking you to reach out to your representatives on the McLean County Board and ask them 2 things. What is the monthly commission the McLean County Board is receiving from IC Solutions for inmate video and phone calls? And call the McLean County Board to use that money to waive or subsidize costs for phone and video calls during COVID-19. To support those housing insecure and homeless, please continue to reach out to the McLean County Board and ask them to be transparent about their housing plans. The public has a right to know. Also, join us on May 2nd as we make masks for the Salvation Army this Saturday. Your mask donation will help our community members at the Salvation Army follow the new requirements and keep themselves and our community safe. And finally, for direct aid, as you heard earlier, many community members came out to speak against the council's vote against having a conversation to support direct aid. People shared their raw stories of financial struggle, and nonprofits confirmed that what we've said for weeks, that they cannot possibly fulfill all of the needs and people will fall through the cracks. So we're asking you to continue to put pressure on the Bloomington City Council, continue to speak out against their shameful inaction, and continue to share your stories and advocate for those in need around you. Thank you to all those who have been getting involved. Please share this information with your friends, family, and coworkers. We are building a grassroots movement here to protect our people. And we do have a YouTube channel, COVID-19 Organizing, with our past meetings. It's never too late to get involved. I'm going to pass it to Dawn to share information on our meetings next week. Dawn, you're muted.
Okay, am I on? Thanks, Cecilia. Everybody, we're changing this up a little bit. First of all, thank you to all of you who have been showing up week after week to these calls. The comments that you put into the chat box and the questions help drive us, help inform us, help us decide where we need to go. But we are going to take 1 week off next week. You heard Jeff talk about the reports from the township and from PATH and from the United Way. And you heard both Jeff and Joel break down housing and food and utilities and healthcare. We feel like we need a week for a chance to compile all the data we have so far, to see where we are right now, and then to see where there are gaps. And finally, to strategize how to fill those gaps and move forward. So we're going to take a 1 week break next week, and we're going to have a call 2 weeks from tonight. That's May 13th. And just so I know that everybody's paying attention and that everybody has heard this, would you please put your name in the chat box and May 13th so that we know you got the message. And with that, I'm going to turn it over to Joel.
Thank you so much, Dawn. And yes, we will be back in 2 weeks. But right now we're here to answer any questions that you have. So after you write your name and May 13th in chat to let us know that you will be back, please drop any questions that you have for any of our panelists in chat so that we can respond. And panelists, as always, if you've seen anything in chat that you'd like to respond to, feel free to jump right in. Most weeks we have about 15 questions by this point. This week, you all are very quiet. But we do have a question from Christopher Haynes. Could the slideshow you put together be available? Absolutely. We will also make sure that this is available on YouTube later tonight. And we'll drop the link to that in the Facebook event so that you can grab the entire YouTube presentation as well. Thank you, Christopher. Any other questions that people have, go ahead and drop them right into chat.
Joel, I see a question from Alan.
Oh, yeah.
I can go ahead and try to answer. Hey, Alan. Yeah, I think you talked about what about vacant housing and there being an estimate of maybe 3,000 vacant housing units in Bloomington. And certainly that's something I think that can be looked at, you know, as a housing option. So let me check with our city staff to see, to try to confirm the number and see if that's a possible viable solution. Okay, I think that question. So.
Okay, thank you, Jeff, for that response, and we look forward to hearing more on that from you. Grace had a question for us, and Grace, you are able to unmute yourself now if you want to go ahead and ask your question.
Sure. I was wondering if there are any current efforts in place to help provide medical care for those who are underserved. I know that direct aid would offer money needed to help people pay for medical care, but I didn't know if there was any specific effort that I could, or anybody in general could help work towards.
Yeah, I'll take a stab at that. If anybody else on the panel knows anything, please jump in. Obviously, in addition to making sure our local governments are making sure people can cover their essentials with direct assistance, all of us have skills that we can contribute, and that's a fantastic question. I do know the state of Illinois currently has a program. It's for people who are currently licensed, recently licensed, or who have certain levels of education that are not yet licensed in a medical profession, so that you can actually do expedited licensure, so that you can support within medical facilities. I believe with testing as well. So I'll look that up. And, Grace, I'll actually contact you and get your email address, so that once I find that, I can send that your way.
I can add to that, Joe, if you'd like. In addition to that, there is also a little known program that's available to anyone, volunteers, and that's the MRC, the Medical Reserve Corps. The McLean County Health Department has put out applications for local volunteers who want to help. So if you want to get involved at a lower level and you're not a medical practitioner or you don't have that background, if we have a tremendous spike in staff need to respond, the medical reserves, you apply and you're ready to respond, and they would call upon you to help. So you may not be doing the same thing that our nurses, but they do have training for volunteers without medical background to help you prepare to be at shelters or at mass clinic sites, stand-up response sites, things like that. So I'll post that link in the chat if you really want to get involved as a medical reserve volunteer. That's something to research as well.
Thank you, Robert. And Cecilia?
I was just going to add the community health care clinic that serves people who don't have proper insurance and live 185% of the poverty level. They're still fully open, and they have emergency only dental clinic services as well.
Thank you, Cecilia. Grace, anything else you wanted to add?
So is there any follow-up for patients who have chronic conditions who maybe won't be able to make it to appointments? Or is that something that hasn't really been worked on? Or we don't have the ability to work on?
I would encourage you to call PATH for some of these specific questions, because they can answer, they can look up in their database. They have a full list of medical health services and are updating it daily, so.
Yeah, informally I can add, we've had a couple of people who have asked for rides. Like we had an elderly, through McLean County Cares, an elderly gentleman who had symptoms and was concerned. Of course, we had to take very strict precautions. So we give him a ride, we take him to get tested at the testing site. So there are some one-off requests like that that we can also facilitate or help with our volunteers through McLean County Cares.
Thank you, Robert. Thank you, Grace, for that question. I heard I might have issue with my audio. Do I sound okay? Okay, I'm getting thumbs up from the team here. So we have time for one more, and I did just quickly want to oh, actually, it looks like she may have jumped off the call, so never mind. But Carla Bailey Smith had been on with us and had posted just an update. She is a member of the Unitarian Universalist Church, and they will be hosting on Tuesday and Thursday with the Immigration Project starting this week. Oh, yep, yeah, I'm getting this week. They'll be starting this week to host that drive-through food pickup for hot meals. And so if you know people who could use that, who know that, who need that, make sure to Unitarian Universalist Church at the corner of Wanda Emerson. That's Tuesday and Thursday, and more information will be on the BN website. So we. Oh, go ahead. Go ahead.
No. I think it's on. That's the site. I think Thursdays. I think Tuesdays, and she may be talking about a different program as well, separate. But Tuesdays it's at St. Mary's School, right behind St. Mary's Church, and then Thursday it's at the other church that you mentioned. And then one last thing, next week, one of one of the folks that's very involved here, I want to give her a quick shout out. The next week, Lori Patton is also going to be joining us with the Quakers, and they're going to be joining and partnering with us and also giving out some additional food items. So just really, really grateful for everyone who's stepping in and helping us. So God bless all these folks for pitching in.
Thank you so much, Robert. And that's all of our time tonight, but I want to pass it on now to Father Gregory Nelson, who is joining us tonight to close us out with a prayer. Father Nelson, are you with us?
Yep.
Thank you, Father Nelson.
Ready.
Let you take it from here.
Okay. Okay, dear Heavenly Father, we thank you for the glory of your Son's resurrection, and we ask you to help us to enter more fully into the graces that you offer us, especially as that concerns the members of our community and the livelihood of our families. We ask you to continue to bless our efforts and the decisions that we make, that we will assist those most in need and be effective in helping those who are less fortunate, especially those in the situations that we have discussed this evening. And we ask for new graces in this time of challenge and change in our community and in our world, that we will find your Son's presence even in crisis, and that we will praise you for the graces that we receive and will be receiving in the future. And we ask everything through Christ, the Good Shepherd, who is our great healer, who in all circumstances leads us closer to you. In his name we pray. Amen.
Amen. Thank you, Father.
You're welcome.
And that's all for tonight. We will see you in 2 weeks. Thank you, everybody.